Today, let's talk about Ascariasis. Ascariasis is caused by the nematode or roundworm called Ascaris lumbricoides. Adult worms of Ascaris lumbricoides inhabit the lumen of the small intestine, and the reproductive potential of Ascariasis is prodigious. A gravid female worm produces around 200,000 eggs per day. After passage in the feces, the eggs embryonate and become infective in 5 to 10 days under favorable environmental conditions. Adult worms can live for 1 to 2 years in the intestinal lumen. Ascariasis occurs globally and is the most prevalent human helminthiasis in the world. It is most common in tropical areas such as Africa and Asia, where environmental conditions are optimal for maturation of ova in the soil. Worldwide, around 1 billion persons are estimated to be infected. Even though infection can occur at any age, the highest rate is in the preschool or early school age children, since transmission is primarily hand to mouth and the children are prone to send everything to their mouth and they are less hygienic than that of adults. Ascaris eggs can remain viable at 5 to 10 degrees Celsius for as long as 2 years. When we see the pathogenesis, Ascaris ova hatch in the small intestine after ingestion by the human host. Larvae are released and penetrate in the intestinal wall and migrate to the lungs by the way of venous circulation. The parasite then causes pulmonary ascariasis, which looks like that of Loeffler syndrome, as they enter into the alveoli and migrate through the bronchus and the trachea. They are subsequently swallowed and returned to the intestine, where they mature into adult worms, and the female ascaris begin depositing eggs in 8 to 10 weeks. Most individuals have low to moderate worm burden and have no signs or symptoms. A large mass of worms might lead to acute bowel obstruction, which might present with vomiting, abdominal distension, and cramps. And in some cases, worms might be passed in the vomitus or in the stool. Ascaris worms can migrate into the biliary and the pancreatic ducts, where they can cause cholecystitis or pancreatitis. Chronic infection with Ascaris lumbricoides impairs growth, physical fitness, and cognitive development, often coincident with other helminthic infections. Microscopic examination of fecal smears can be used for diagnosis because of the high number of eggs excreted by adult female worms. And sometimes, ultrasound examination of the abdomen is capable of visualizing intra-abdominal adult worms. When we came to the treatment options for gastrointestinal ascariasis include albendazole, mebendazole, or ivermectin. Piperazine citrate, which causes neuromuscular paralysis of the parasite and the rapid expulsion of the worms, is the treatment of choice for intestinal or biliary obstruction and is administered as rub through NG tube. Surgery might be required for cases with severe obstruction. Regarding prevention, anti-helminthic chemotherapy programs can be implemented in one of 3 ways. The first one is offering universal treatment to all individuals in area of high endemicity. The other way might be offering treatment targeted to groups with high frequency of infection, such as children attending primary school, or offering individual treatment based on intensity of current or past infection. Improving education about practice of sanitary conditions and the sewage facilities and discontinuing the practice of using human feces as fertilizers are the most effective long-term preventive measures. Thank you for watching.